How's it going, guys? It's your boy, Shit79, and today I'm here to talk about a more serious topic, and it's that September is Ovarian Cancer Awareness Month. Ovarian cancer is a hard-hitting cancer for my family because my grandma on my mom's side had ovarian cancer, and so it puts my mom, my sister, and now my little niece, when she grows up, at a higher risk to develop ovarian cancer. And at the end of this video, there will be signs and symptoms of ovarian cancer, and if you have any of those, you should go to the doctor, because the earlier it's detected, it's more treatable, and a lot of people recover from early detection, whereas later detection usually is not a good outcome. So stay tuned to the end of the video, and let's get into it. Well, to raise awareness about anything, it seems like you have to do a challenge of some sort, and I came up with this challenge on my own. I haven't seen this challenge anywhere else, so it's completely original to me. I don't even know if it's a good idea, but we're gonna do it. Basically, it's I don't know, the water challenge. I just have a gallon of water, and I'm gonna see how much water I can drink in a minute, and it's like the same premise. Nominate 3 people, and there's for the whole month of September, there's going to be the very first link in my description is going to be to donate to the Ovarian Cancer Foundation, which I'm going to do too, and I hope you do, and hopefully we can make a difference, and just hopefully we can get this terrible cancer that has affects millions of people a year, and takes a lot of lives, because it's not a well-known cancer, and a lot of the signs and symptoms can go undetected by women. So that's why we're going to do this. And as soon as I get my stopwatch ready, alright, here we go. Alright, unopened, 1 minute, let's do it. Oh, it's fucking cold. Alright. That was like 45 seconds. And drank like almost a half gallon of water. Alright, guys. I nominate Trevor Haynes, AJ Polkowski, and Amy Noggle do this challenge, post a video. Hope you guys like it. And as I promised, it's going to cut away, and it's going to be signs and symptoms of ovarian cancer. And the link will be at the end of this video, as well in the description. Donate mean a lot to me, a lot to my family, and can mean a lot towards finding a cure for ovarian cancer. Alright, it's been your boy, Shit79, and I'll see you guys later. Hey guys, thanks for sticking around to the end of the video. These are signs and symptoms of ovarian cancer, and I'm going to go over some of the risk factors that put you at a higher risk for ovarian cancer. And one of the first things that I have to mention, guys, is that Pap tests do not detect ovarian cancer. It's one of the major misconceptions, and when women go and start having pap smears done or Pap tests done, they're like, oh, well, he didn't find any ovarian cancer, so I don't need to go get checked if I'm having any signs or symptoms, and that's not true. Pap tests detect cervical cancer, not ovarian cancer. Okay. Some of the risk factors that put you at a higher risk for developing ovarian cancer is having a personal or family history of ovarian cancer, breast cancer, or cervical cancer, and that's what puts my family at risk. Is since my grandma's had ovarian cancer, that puts like my mom, my sister, and any future generations at risk to develop ovarian cancer, and it does push your percentage of developing ovarian cancer up to 10% above what it would normally be, and that's according to the American Cancer Society. Being postmenopausal, being obese, and experiencing undesired infertility or using fertility drugs. Symptoms of ovarian cancer. 19% of ovarian cancer cases are diagnosed before the cancer has spread outside of the ovaries when the disease is most responsive to treatment. That is a really low number, and this is why we really need to push for ovarian cancer to be more well known, and the risk factors along with the signs and symptoms that come with ovarian cancer. And you'll understand why many women just put these signs and symptoms off, because you can just experience these with a common cold, but once you get postmenopausal, or if you're overweight, or if you have a family history, or you use fertility drugs in the past to get pregnant, if you experience these over the age of 50, you should really consult a doctor immediately. And those are bloating, pelvic or abdominal pain, trouble eating or feeling full quickly, urinary urgency or frequency. And that's why we did the water. I couldn't really explain it good in my video, but the bloating feeling and feeling full quick, or you had to pee because you just tried to chug a gallon of water. So these are the signs and symptoms, the most common, and you can just get these throughout the day. But like I said, if you're over 50, you might want to consult a doctor if they're persistent. In addition, you can have upset stomach, back pain, pain during sex, constipation, menstrual changes, unexplained changes in bowel habits, unexplained weight loss or weight gain, and ongoing unusual fatigue. Again, these symptoms are usually they're just blown off by women, but if they're long persistent, I'd say for more than a week, like American Cancer Society says 2 weeks, you should seek a medical attention from your gynecologist. Prevention, how you can prevent ovarian cancer. The science is still far from knowing how to prevent ovarian cancer, but there is mounting evidence and suggestive ways to reduce one's risks in developing ovarian cancer. Oral contraceptives, breastfeeding, and pregnancy, surgical prevention. Let's go over these one by one because those are pretty broad topics. How oral contraceptive works. Women have used birth control pills for 5 or more consecutive years reduce the risk of developing ovarian cancer. The risk continues to drop the longer birth control pills are used. However, the use of birth control pills may elevate some risk of developing breast cancer in women. So basically, the hormones that you get from oral contraceptives can decrease your risk for ovarian cancer and cervical cancer. That's not mentioned in this article because it's just about ovarian cancer, but it can increase your risk for breast cancer and other cancers. So that's not really a best way, but it is one way that the American Cancer Society notes that can prevent ovarian cancer. Breastfeeding during pregnancy. Having one or more children, particularly before the age of 25, and breastfeeding may decrease one's risk of developing ovarian cancer. There's not much science behind this. It was a small group study performed by Harvard medical students, and that was their findings, and the American Cancer Society has decided to back those findings up. Surgical prevention for women who are particularly at a high risk for ovarian cancer, who are outside of their reproductive years. Certain surgical procedures such as tubal ligation, tying the fallopian tubes, hysterectomies, removing the uterus, and removing the ovaries can greatly reduce the relative risk of developing ovarian cancer. However, all surgical procedures carry their own risk and should be discussed fully with a physician. So, those are some preventative ways. They're not like it said at the beginning. We're still way behind on how ovarian cancer works and like what you can actually do in life to prevent that, other than what I just said. Diagnosis, if you want to know how you get, since a Pap test doesn't do it, they do pelvic exams, transvaginal sonograms, and a CA-125 test. The CA-125 test is the most accurate at detecting ovarian cancer, and it's really good for the early stages of detecting ovarian cancer early. The transvaginal sonogram is the next most reliable one. Usually they do a CA-125 test along with these. If those levels are elevated, it usually does mean cancer is pregnant or is present, and the sonogram can just help them visualize where the tumor might be. The stages of ovarian cancer, we'll just go through these quickly. If like any other cancer, stage 1, 2, 3, and 4. Ovarian cancer is in stage 1, ovarian cancer is confined to one or both ovaries. Stage 2, ovarian cancer has spread to other locations in the pelvis, such as the uterus or the fallopian tubes. Stage 1 and 2, the success rate is at 52%, and you'll see that it drops off quickly here at stage 3. Stage 3, the ovarian cancer is spread to the lining of the abdomen or the lymph nodes within the abdomen. This is the most common stage of the disease that is identified at time of diagnosis, which is really scary because the percentage rate of success at stage 3 is at 28%. Yeah, 28%. So that's not good odds, and stage 4 is even worse. Ovarian cancer has spread to organs beyond the abdomen, and the survival rate is only 10%. So guys, this was the signs and symptoms and some of the risk factors for ovarian cancer. I really hope this helps somebody out, and there's going to be a link to this website as well as the Ovarian Cancer Foundation in my description, like I said. And as always, it's been your boy Sheets79. I thank you for watching, and bye.